Hello, good afternoon to all of you. I am Siti Fairuz, an occupational therapist. So I will be sharing with you about the occupational activities among the older persons. Globally, by 2030, there is estimated to have 1 in 6 people of age 60 years and above, and by 2050, the 60 years and older is expected to reach 22% of the population. Meanwhile, here in Malaysia, currently we have about 11.2% of the older persons, and yet is estimated to become an aging country by 2030 when the total of the older population reach 15%. So due to the aging of the global population and the derivative increase in aging related problems, WHO already mentioned that there is a strategic need of promoting healthy aging among the older persons. Aging people commonly contracted with multiple chronic disease and facing many kinds of geriatric syndrome. So all of these problems actually could affect their physical capacity, functional status, and also quality of life. The declination of functional performance among the older person obviously seen when they reach 60 years. A study done by Institute of National Health Malaysia showed that the level of dependency in both activities of daily living and instrumental activities of daily living among the older persons has 2 to 3 times increase as compared to the pre-older persons group. Same goes to the physical activity participation. The physical activity participation among the older persons has seen to reduce 2 times as compared to the older persons. We just wonder why in just 10 years the dependent level in ADL and IADL has increased and they tend to not physically active. There are few studies done in Malaysia and overseas regarding the level of activities among the older persons. The older persons at age of 60 years and above have the tendency to reduce their activity levels, and this mostly happens to the non-working older persons. This could lead to many problems after that. The older persons also like to spend their daily life being inactive, seldom engage in any activities, doing nothing, taking frequent naps at daytime, and also take a rest at many hours. A study said that the aging is actually a malleable process. It is a manageable or changeable process. The aging has high degree of plasticity, which means that the aging process could be slowed down. The geriatric syndrome could be improved through the change of the lifestyle, control the medical problems, and looking at the environmental factors that could limit the activity participation. World Health Organization in its guidelines recommend the duration of physical activities that should be carried out by the older person. The WHO actually recommends 50 minutes of moderate intensity exercise or 75 minutes of high intensity exercise throughout the week. But not many older persons actually can apply this to their daily life. Bringing the older person to have intensity physical activities at certain frequencies may limit the participation among them. Fortunately, many studies mention that physical activities among the older persons is not just by doing intensive kind of exercise or providing specific prescriptive intensities. Activity as low as 15 minutes of physical activity or daily living activity could actually result in 4% of decrease in mortality. Moreover, occupational activities such as gardening, doing home maintenance, shopping also can increase physical capacity and increase their quality of life. So in occupational therapy practice, this kind of activities also called as occupational activities. In the eyes of occupational therapy profession, the profession believes that active engagement in occupation can promote, facilitate, supports, and maintain health and participation. Occupation is one of the domain in OT practice. We use the occupational activities to measure other person's performance, and we also use the activities as part of the intervention. There are 9 occupations in occupational therapy framework, which are instrumental of activities of daily living, social participation, leisure, play, work, education, rest and sleep, health and health management. Physical exercise is also part of the occupation and it is under this health management. I would like to share with you about the interventional research that have been done in the overseas. Many kinds of occupational activities that has been implemented in that research, particularly focusing on the physical exercise. However, there are also some other occupational activities such as games, social activities, craft and leisure activities. All of these activities showed positive outcomes toward functional performance, physical capacity, and also the quality of life among the older persons. Besides that, there was also one study using a series of 20 hours of lectures about the occupational engagement, social activities, and eating health related activities among the older persons. Even though the study only using educational methods, it showed positive outcomes in the functional performance and the quality of life after the second evaluation. The study also reported that the older person have lack of awareness regarding activities that they can do to replace the physical exercise. Therefore, we should encourage older persons to participate in all occupational activities as maximum as they can. For example, despite of the limitation that they have due to the disease and the physical problems, we should encourage them to help us in helping them. Caregiver and patient education is important in this matter. The professional, especially the occupational therapist, should educate on this and recommend suitable tools, equipment that can increase patients' independence level. Here are some instrumental activities that we can recommend to the older person to keep them active. These activities are not meant for the older person with medical problem or physical limitation only, but for the pre-older and older people to take the preventive action following their retirement and unemployed daily life. The family should encourage them or bring them shopping together or assist them or allow them to drive if they are able to drive safely. Besides that, we should encourage the older people to keep active by doing physical activity, doing leisure activities, and also involved in any play activities. As conclusion, in promoting the healthy aging among the older persons, occupational engagement is one of the most important components to avoid sedentary behavior and cause the non-communicable disease in the future. Besides that, healthcare providers also play a big role to provide strategic intervention for not only sick older people but for just retired older persons. Nevertheless, the family is also one of the important wing for the healthy aging. As healthcare provider, we can refer to these WHO guidelines for more information on the geriatric, their problems, and also the recommended intervention strategies and many more. It can be searched online. So that's all from me. Thank you.